question, the member from London Fanshawe.
Questions to the Acting Premier. The Association for Non-Profit and Service for Ontarios and the Ontario Community Supports Association have asked you to protect public health care. Instead, you dropped the requirement that only not-for-profit organizations are eligible for provincial funding to provide community support services. Minister, you know that privatization costs more, has less oversight, and ultimately Ontario's families pay the price. The Wynne government didn't have a mandate to privatize Hydro One, and the Wynne government doesn't have a mandate to privatize our public health care system either. Minister, Acting Premier of Ontario, will you protect Ontario's seniors so they shouldn't have to empty their wallets to get the community supports they need? What will it take for the Wynne Liberals to stop public health care dollars from going to profit?
Thank you. Deputy Premier.
To the Minister of Health and Long-Term Care.
Health, long-term care.
Well, thank you, Mr. Speaker. And we've been listening to our stakeholders as we move through the implementation of the Patients First Act. And it's critically important, the advice that they provide, the experience that they give. So that's why today, in fact, Mr. Speaker, I wrote a letter to all LHINs across the province asking them, because we're not making any changes, we're actually maintaining the status quo, Mr. Speaker, and that was important to all parties. But in the interim, as we further consult with all stakeholders over the next several months, I've asked our LHINs not to engage in any new contracts with new community care providers, Mr. Speaker. So I've asked them, in fact, I've requested that they implement a moratorium so we can have this consultation, and we'll have the consultation with all our stakeholders.
Member from London Fanshawe, you asked the question.
Thank you.